Federal public health officials say that flu season has officially begun in Canada. So the Public Health Agency of Canada says that positivity rates for influenza across the country have stayed above 5% for 2 consecutive weeks.
Yeah, infectious disease experts say rates haven't reached those levels in Ontario just yet, but they're expected to soon. And for more on that, we are joined by Dr. Kieran Moore, Ontario's Chief Medical Officer of Health. Doctor, it's good to have you. Thanks for joining us.
Oh, thank you.
So let's start with COVID, because we know levels of that virus have been incredibly high lately compared to what we've seen over the last year or so. What are you seeing there?
I'm sorry to say we still have significant COVID activity across Ontario, roughly 1,800 people in hospital, 100 needing intensive care. But thankfully, 1.8 million Ontarians have come forward to get vaccinated, although we certainly want better protection for those that are over 60 or those with any underlying illness. So if you haven't come forward yet, we still have over 3,200 pharmacy partners being available to you to be vaccinated every single day heading into the holidays.
And, respiratory illness, it's the winter time, kids. How does this all come together? And how do you tell the difference between just a common cold and something more serious?
It is sometimes very difficult to differentiate sort of RSV, respiratory syncytial virus, versus influenza versus COVID. And so the basic protections that we advise about staying home when you're sick with any respiratory symptoms is important. Good hand hygiene will protect you. Covering your cough will protect you, as well as staying up to date with your immunizations. That's a real key message. A reminder that it takes roughly 10 to 14 days to build immunity after a vaccine, and it's very important that we try to maximize our level of protection in the coming week and 10 days so that Ontarians have the safest holiday season and New Year possible.
Yeah, and when it comes to immunizations, you were just mentioning that, obviously, COVID vaccines, the flu shots. Are you seeing the amount of people who should be getting immunized actually going outside and doing that?
No, sadly, 1.8 million Ontarians isn't enough. 60% of those over 60 haven't come forward to get immunized, and yet there's roughly 800 Ontarians over 80 and 700 Ontarians over 70 in hospital today with COVID. So that's a key population we need to maintain immunity against COVID. Natural immunity against the virus fades with time, and so does immunity from the vaccine. And those populations really need to stay up to date with their immunizations. The clinics are available, the vaccines available, pharmacies across Ontario, as well as public health agencies are prepared to immunize. And this next week is a real push to stay protected so that Ontarians don't have to spend their time in an emergency department or in the hospital over the holiday season.
Okay, vaccinations, immunizations. What are you hearing from parents who are reticent to move forward with these for their children?
So it's important to have any of the questions that you may have answered. Your healthcare provider, your pharmacist, your nurse practitioner are all prepared to answer any questions you have about vaccinations. The COVID vaccination and influenza are safe and effective, can be given together, and provide great protection heading into a dangerous time of year from a virus vantage point. As well, for RSV, it is highly transmissible for the very young and the very old, but those layers of protection are still important to protect against any of these viruses.
Okay, some good messages there. That is Dr. Kieran Moore, Ontario's Chief Medical Officer of Health. Thanks for joining us today, Doctor.